fun on this Friday, right? We're going to learn a lot too. So our first topic here, people have been talking about Taylor Swift's dad. He had that heart surgery after he had blockage. It was discovered during a stress test.
And here to tell us about all this important information, screening tools especially, is Cleveland Clinic's Dr. Christine Jellis. Great to have you.
Great to be back.
Boy, we've been working you over before we even started.
She's the sweetest, and it always helps having wonderful doctors that get their patients, that are kind to their patients, that really make you feel like when we have questions for you, you're willing to answer them, willing to give us the best advice, and you're the best of the best. So
well, thank you for saying that. We're here to serve, and it's always nice to be back with you and just help where we can.
Well, it's pretty stressful just being here right now, right? So what do we do? How do we relieve that stress?
Well, I think we were talking about being proactive about our health. Mm-hmm. So the first step is always have a great primary care provider, a cardiologist if you need it. And then that way you've already established a good relationship. So if you start getting symptoms like shortness of breath on exertion, chest pain, palpitations, feeling like you might be going to faint, those types of things, you know who to go to, and then they can guide you as to what are the appropriate tests that we need to do. And sometimes those tests are at rest, or sometimes we do what we call stress testing, which acts to mimic what our heart does when it's exercising, and that gives us some more information.
So what kinds of symptoms would someone be feeling that would require them to get a stress test?
Mm-hmm. Good question. So typically it's chest pain. That's the big ticket item that we want to be aware of. But there are other symptoms, particularly in women. Often we don't present with the classical symptom of, chest pain or feeling like an elephant sitting on your chest.
Ooh.
So it might be something like shortness of breath with exertion. Sometimes people will have palpitations, dizziness, other symptoms. So I think that's where the first step is having those symptoms assessed and then being guided as to what the right test is for you, because there are lots of different tests that we can do, and we want to make sure that we pick the right test for the right person.
So different stress symptoms, different stress tests.
It can be, or it can also be tailoring the stress test to the person, because a lot of our stress tests involve exercise. And one of the most common questions people say to me is, oh my goodness, am I going to be able to walk on the treadmill? I can't run on a treadmill. I haven't done that for 30 years. Mm-hmm. So the reassuring thing is that we can tailor either an exercise stress test for people, and most people don't have to run, so that's nothing to worry about. But we can also do a pharmacological stress test where we give people medication to speed up the heart rate, mimic what it's like when you exercise, and still get useful information from that stress test regarding whether the person has got underlying coronary artery disease or other things. We often do stress tests for other conditions like valvular heart disease and hypertrophic cardiomyopathy. But stress testing for ischemic heart disease, blockages in the coronary arteries, is really the main utilization of that test.
So what will that, in case someone is nervous, people just get nervous to get tests sometimes, and it's a fear for them. So what would it be if they obviously don't have to be on a treadmill, you can do it another way, but if they get on the treadmill, what is the process like?
Absolutely. So all of these tests are done in the hospital in very controlled circumstances. So if we're looking for problems, better that we're doing it where if something does occur, you've got all of the resources immediately there to help. There are always supervising caregivers that we have at the clinic. They can be doctors, nurses, physicians. In some cases, they'll be imaging technologists who are involved with the test. And we're all there working as a team to look after the patient, get the information that we need, and hopefully that we can then guide them on what the next steps of their treatment needs to be. But it's all very controlled. This is what we do every day. We love to do that for our patients, keep them safe and help them on their journey.
Yeah, I've been through some of these things because I've had some situations. And the last time I did it, I had a stress test on the treadmill, but they also give you an injection while you're doing it. And boy, they got a crowd of people standing around to make you feel really safe. What's going on? Because you don't know what's going on. You're sort of.
Absolutely, and sometimes we need that injection to get the heart rate to where it needs to be to get a diagnostic test. There's no point having you there and then doing a sort of half version of the test and not getting useful information.
It's like going to a sporting event. They're cheering you on.
Absolutely.
You know what? They should just put people at a Browns game and do the stress test there. Right?
That'll put up their heart rates.
Heart rates will go crazy. Are there risks at all in doing this?
There are always risks with everything we do, but reassuringly the risks are very small. And we go through all those risks with everyone in a consent process before they do the test. And we're always happy to talk about them ahead of time with our patients. But by way of reassurance, these risks are very low. And I would say much better to do the test and get the information so that the appropriate treatment can be given than not do the test and perhaps have a higher risk of something happening if the person wasn't being taken care of.
So if you have some of these kind of symptoms we talked about, and then they disappear, like you've had these symptoms and they go away for a couple of weeks, should you stop thinking about it, or should you say this could happen again at a very inopportune time?
I think it's a great question, and it always depends on the context of the symptoms. So if someone is getting exertional chest pain, so they walk up a flight of stairs or walk up a hill and they start getting symptoms, that might be very different and more suspicious for an underlying coronary artery blockage than perhaps if they were moving furniture and they tweaked their shoulder and it was something that was related to an incident that sounds more muscular. But that's where I think we can provide some guidance around those symptoms. So it's always best just to check in with your doctor and run the story past someone, and then they'll guide you as to whether it's something not to worry about or just to monitor, or do we need to do a stress test, or in some cases the problem might be so significant that we skip the stress test and move on to a more invasive test as the first thing. And so we'll help everyone figure out what pathway they should be taking. It all comes back to just talking things through and communication as the first step.
When it comes to our heart, we don't want to take risks,
Yeah,
right?
taking the worry out of it, I think, is a big, big deal.
Absolutely.
It's so true. So if something just feels out of place, something feels different, it doesn't hurt to just get it checked. Better safe than sorry.
Absolutely. Listen to your body. That's the number one advice.
We love when you come in. Thank you so much
thank
for
you
being
for
here
having
with
me.
us
Thank
this
you very
morning.
much.